I want to welcome everyone that is tuning in to hopefully gain some insight and some knowledge. Today, we're speaking with Dr. Rukhsana Iqbal, who is a board certified physician who specializes in treating both medical and psychiatric illness. She's received her degree from Northeast Ohio Medical University and did a dual residency in family medicine and psychiatry at University Hospitals Case Western Reserve University, and then went on to complete a fellowship in consult liaison psychiatry at Northwestern University here in Chicago. And she's also been practicing in Hinsdale for the last 10 years and happens to teach students both at Midwestern University as well as Loyola McNeil Hospital. And she lives in the western suburbs with her husband and 3 kids. So I want to thank you, Dr. Iqbal, for joining us today and for sharing your expertise and insights and experience in kind of having this introductory conversation on mental illness and mental health.
Absolutely. Thank you so much for having me on. I think it's wonderful work that you're doing by opening that conversation up about mental health and mental illness because it's something that is definitely in our communities. And I think people really benefit when we talk about it openly.
Thank you so much. And so, this will, as I had mentioned, be an introductory conversation. So before delving in deeper into the conversation, I really want to touch up on what mental health and mental illness is, how real is it, and how you potentially address this conversation with individuals who are in the community who may not have as much experience in it, or maybe experiencing family members who are dealing with some of these trials and tribulations, but are having a difficulty maybe accepting its reality, or how it is that you would explain this to some of those individuals.
Well, I think with mental health or mental illness, a lot of times different uh, di- the different illnesses that are there sort of exist. And you can think about it sort of across the spectrum, where people may be experiencing things like schizophrenia or bipolar disorder, and we would classify those as severe mental illnesses. But there also exist things like depression, anxiety, eating disorders, substance dependence, and for some of those disorders, some of those symptoms might be things that people may experience in real life. So some people may experience sadness or they may experience anxiety. And I think sometimes what can be difficult is trying to figure out when do those symptoms rise to that threshold of a disorder. And so I think that's where it can be helpful to talk to your doctor, even just your primary care doctor, because many of them are comfortable with diagnosing things like depression and anxiety and can even manage some of that on their own. But if they have to refer to a psychiatrist for extra help, then they can. And I think for a lot of Muslims, especially, I've had several Muslim patients. I think even recently come to me, and it seems as though people are talking about it more. Younger people and even older people too. There is more discussion about mental illness and wanting to get help for themselves or their family members. I'm starting to see a little bit of a shift within people, and then even in the community at large. I think we're starting to hear more about it, even through the different masjids in the area. So that's been really nice to see too. Imams talking about it during their Jummah khutbah or having dedicated program series on mental health. So it's good to see that. I think people are starting to talk a little bit more about it.
Yeah, and so, and kind of not only accepting its reality, but getting an understanding, or can you provide us with an example of maybe one particular disorder and some of the biology that's involved in understanding how real this potential disease can really be?
hmm Sure. So if you think about something like an anxiety disorder, whether it's panic attacks that someone might have, or even just an overall sort of overwhelming, consuming anxiety about everything and anything. If you kind of drill down into the biology of it and you think about our brains, and the different parts of our brain, you have your basic brain stem part of your brain that really controls vital functions like your breathing, heart rate, etc. And then you have your cerebrum, your left and right sides of your brain that really are responsible for things like language and vision and thought, imagination, and then and more executive functioning, more logical thinking, that kind of thing. And if you think about the system that sort of connects, sort of like that rudimentary basic brainstem part of your brain and the more sort of evolved part of your brain, that's called the limbic system. And there's a few different parts of your limbic system. You've got your hippocampus, which is responsible for memory. And then you also have your amygdala, which helps to kind of coordinate emotional response. And so if we think about anxiety, everyone experiences anxiety, and anxiety in and of itself can be a helpful thing, right? If there is a danger in your environment, you need to feel anxious enough to act upon that. But what happens with anxiety is that that message of there being danger in your environment sort of gets misinterpreted, where now so many things that are seemingly benign appear to be very dangerous and threatening, and really starts to fire up that amygdala and overrides that front part of your brain that's responsible for logical thinking. And when that happens, then that's when people start to have a lot of anxiety thoughts, a lot of worries. It may even change their behavior. So they may start to avoid things that previously they had no trouble doing, like going to the grocery store, for example. And what we find is that, we think about treating anxiety disorders, both medications as well as therapy can help to kind of tone down that amygdala response, get that frontal part of our brains back online so we can start to think more logically and to get the anxiety under better control.
Yeah, that's great. I think that providing that again insight into the actual physical involvements of the brain can hopefully help individuals realize that these are real issues that people deal with, and not just something that can be overseen, or for some individuals this is something that they deal with temporarily, but other individuals may be facing this long term, right? Can you share some of that as well, as far as how it may differ?
Mm-hmm. Sure, right. So, in every person's life, there are stressors that come up or losses that come up. And people can very understandably experience sadness or even depression or anxiety in response to those events. And for many people, that may last a period of time, and it may not affect their functioning, and they may be able to kind of get through it and move on, and then they don't ever experience that again in their lifetimes. But for some people, it can become more of a chronic issue. And when we think about depression, depression is a very common thing. And in any given year, about 7% of Americans experience depression. And when we think about over the course of a person's lifetime, across the world, like 20% of us, 1 in 5, will experience depression. So it's quite common if we look at just one mental illness. And I think the important thing is to sort of figure out, okay, when does that, say, depression or anxiety, even if it's in response to something that's understandable, maybe like the loss of a spouse or a child, for example, when does that become a disorder? And really, the defining sort of feature is when it really starts to impact your functioning. If you are having to call off from work and you're not able to make it in, or you're laying in bed most days and you can't really take care of your family or the house, that's when it's really starting to impact functioning. And then those are sort of those red flags that would say, let's get in to see someone and get this taken care of.
Absolutely. I think that hopefully can provide individuals with, again, a little bit of an understanding on how you can differentiate something that an individual may just be commonly temporarily affected by it, and someone who may be dealing with it a bit more chronically and long term. And can you also provide, a definition of the difference between chronic and acute as well?
So, right. So, acute usually is something that is happening very short term. So, maybe it's going on for a few weeks or so. But, technically speaking, for depression, for example, you really only need 2 weeks of relatively severe symptoms impacting all sorts of things like sleep and energy, concentration, appetite. If those symptoms, and you're having multiple symptoms, and they're affecting your functioning, and it's lasting for at least 2 weeks, we would qualify that as an episode of depression that would be helped by therapy and or medications.
So that definition, obviously, as far as the differences between acute and chronic, differs from disorder to disorder as well.
It can, and it. I think it's important to sort of remember that, even if it's a short-term thing, if it's very intense and it's really impacting your ability to live your life, then that would sort of meet that threshold of seeking care and seeking treatment. And so I think that's important to remember too. And a lot of times, what we see is that people may think, well, I've only been feeling badly for maybe a couple weeks, and maybe it'll get better. Maybe I'll just sort of wait it out and see. And then symptoms go on for several weeks or even months before people will seek care. And you hate to see someone struggle for so long before they seek care when there are treatments available that could potentially help them to feel better sooner. So I would always say that it's better to seek care earlier rather than later. It's a lot easier to treat things at the beginning stages of an illness versus sort of later, as more and more aspects of life are impacted.
Absolutely. And so, I think with those initial steps of experiencing or knowing and acknowledging that you are experiencing a change in that regard, when we talk about our communities and the challenges that we face as communities and some of the barriers and taboos that come with that, that is also a large hurdle for people. I know you mentioned seeking that treatment and that help and the therapies that may be involved early on. And sometimes individuals wait too long, right? Sometimes people have this potential shame or concern of what others in the community may think of them, or there are also concerns of confidentiality when it comes to seeking clinicians who may have a similar cultural or even religious background, just because there may be a bit more comfort with clinicians with that similar background. So can you also provide a little bit of your own experiences maybe of some of these barriers and taboos that we deal with as communities, whether it's a Muslim community or any community in general? This is kind of across the board from what I've realized. And it's also dependent on maybe even on the culture that you come from. I think mental illness and mental health is potentially seen differently from different backgrounds. In some regards, unfortunately, it's seen as a weakness. And so if you can kind of provide, again, a little bit more insight on how to overcome some of those taboos and those barriers to better ourselves rather than some of the concerns that we have of what others may be thinking.
Mm-hmm. Right. It is something that I think our Muslim community struggles with, where people can feel very ashamed for even having depression or anxiety. Sometimes I've heard people say, I don't want to complain about my problems. Why should I complain when there's so many other people that are suffering in the world? You hear that quite often. But you're right in the sense that, it's not just the Muslim community. I have a lot of patients that are maybe of Indian or Pakistani background, across all religions, Hindu, Muslim, Zoroastrian, Buddhist, like across all faiths, really, Christian also, where, just because of the culture of, kind of keeping things in the family, keeping things private, not wanting to air out dirty laundry, especially when we think about marital conflicts, and not wanting to talk publicly about that, and having to keep a certain happy face on, and to make it look like things are just fine from the outside, when in reality, life is just crumbling on the inside. And I think, part of that, I think, is because in a way it can be easy to sort of hide the fact that someone is struggling with a mental illness sometimes. It's not quite as obvious, as someone who might be going through something like cancer, for example, where, you see people maybe talking about that, or the community rallying around that person and providing a lot of support, and visiting the family and talking to the family and providing meals for the family. And so that may be very obvious to see that this person is going through cancer, and then the community is able to rally around that family. But for depression, or let's say schizophrenia or bipolar disorder, even some of the more severe mental illnesses, or substance dependence, for something like that, especially in the Muslim community, it's very hard to overcome that taboo and stigma to seek treatment. But it's hard to really see the community rally around that person, because it's so easy, relatively speaking, to hide that and to not let people know that they're going through that, unfortunately. And so I think that what helps to overcome that is to really understand that mental illness is a legitimate disease. They are brain disorders, and there's so much research now about a lot of the biological underpinnings, a lot of the genetics that are involved. I can't tell you how many times I see people that have experienced trauma in their lives, and it's not just them, it's just generations of trauma, going back to parents and grandparents. And, oftentimes it's not that one person in isolation that has a mental illness. There's oftentimes a family history. And, because people in previous generations didn't talk about it hardly at all, it's usually as maybe that person who's experiencing mental illness is sort of thinking back and reflecting upon grandparents or cousins or aunts and uncles, and sort of connecting the dots and sort of thinking that, okay, maybe that person was depressed, or maybe that person was anxious. And I think as we start to think about mental illness as a biological disorder, and to realize that there are so many biological underpinnings, that it helps for it to become a more legitimate illness and something that you can seek treatment for. And like I said, I think I've seen more and more people starting to seek treatment because they're starting to talk about it just a little bit more, with their friends, sometimes with their family members. So it's helpful, I think, to be able to seek that care, and to really, give yourself the benefit of full treatment. Sometimes I see people, because there are a lot of physicians in the Muslim community, and so sometimes people will sort of maybe ask a family member for help, or a medicine, and in those situations, they're not really affording themselves the full benefit of treatment, of going to maybe a psychiatrist or a therapist that is not connected to you. Someone who you can go and see that person. They're going to keep everything that you say confidential. It's completely separate from that person and their family. And by law, we have to keep it confidential. We can't disclose things, unless there's a worry or concern about that person being dangerous to themselves or someone else, of course. But I think it can be a huge relief sometimes when people come in and they realize that, that space is there for them, and I'm there to help advocate for them, and to help them feel better, and they can come to that place and bring all of their problems and, all of the turmoil that's going on in their life, and really have a place that's safe and confidential, and they don't have to worry about it getting sort of spread back through community channels, etc. And I think when people make that connection and they see that, I think they really do appreciate being able to have a confidential space, safe space to be able to talk about what's going on in their lives, and the fact that you're talking about it with a professional, someone who's an expert who knows what to look out for, how to help that person. And there are a lot of Muslim therapists as well now. I think we see more and more Muslims going into fields of psychotherapy, which is wonderful to have people that can understand some of those nuances about our culture and our community. But at the same time, too, sometimes I think people will get stuck on, well, I have to see a Muslim therapist, or I have to see a Muslim psychiatrist. And I mean, the good thing is that in the Chicagoland area, and we have a lot of psychiatrists that are very familiar with the Muslim community, have a lot of Muslim patients, and if it's a good therapist or psychiatrist, they're going to be open to wanting to learn more about, some of those idiosyncrasies about our community. So I would encourage people to, get that help and really see if it's a good fit. For some people, it can be sometimes a better fit if the person isn't Muslim and somehow connected to the community. Sometimes that can be a better fit too.
Yeah, so I think what you mentioned a little while ago also is actually really important as far as individuals really seeking out help and getting that whole treatment and approach, right? Similar to what you had said, sometimes people may just, speak to a family member, may not give them the full story, may also be sharing medications with someone else, right? If they feel like, oh, I have a sister who takes this medication for her depression, I've been feeling down lately, maybe I can take this medication and it'll elevate my mood as well. Now, those are things that we do not want to, support or suggest people to take those routes. And you mentioned, psychiatrists and therapists. Can you kind of give also individuals an idea of what some of the differences are in that role, and how getting treatment for in an approach where you're able to treat it wholly rather than certain particular symptoms that you may feel like you're having, and some of the issues that may arise from taking that route where you're talking to family members or taking someone else's medications rather than getting that whole whole treatment approach.
Mm-hmm. Right. So sometimes people can mix up, what does a therapist or a psychologist do, and what does a psychiatrist do? So a psychiatrist is someone who has gone through medical school and then through psychiatry residency training, and can prescribe medications and really make sure that nothing else sort of medically is contributing to what's going on, because there are medical illnesses too sometimes that can present with psychiatric symptoms. And then a therapist is sort of a general umbrella term for that provides psychotherapy, and that could be a psychologist, like a PhD psychologist. It could be a person that has their master's degree in social work and they're providing therapy. There's a couple other degrees that enable a person to provide therapy, and some psychiatrists too will provide therapy as well. But they really focus on all of the sort of behavioral strategies and things to help people with their mental illness, and helping people to understand more about their illness, and to really do that talk therapy.
Okay, excellent. And then also to kind of go back to a point that we were just talking about a few seconds ago with individuals really seeking out that help. How do you address the issue of what will other people think? If it's a parent that is wanting to get treatment for their child, but they're concerned about what community members may say or the shame around that. I know you're saying, you had mentioned that the shame hopefully can kind of subside as more people begin to talk about this and realize the reality of it. But how exactly do we address the concerns that people may have, that, where they may say that, what will other individuals in the community think about it? What will that mean for our child moving forward? People worry about their kids settling down and getting married. If community members know about this, will that then, cause an issue for my child later on? Maybe it's best that we don't talk about it openly. How do you address those concerns and help individuals really seek out that help and treatment so that they can, improve their own quality of life?
Hmm. Well, I think what I've seen is, for parents especially, like if they're seeing their children struggle through something, oftentimes that concern and love of their child really can outweigh that worry about, what will people say. And so the people that are coming to me or to my child psychiatry colleagues have been able to get over, I think, that fear of what will people say, because they're just so concerned about their child. If their child, let's say, is went from someone who was doing really well, having friends and performing fine in school, and then there's a change where they're not doing well, they're more socially isolated, they're not doing well in school. Oftentimes then, it's usually a significant change that will lead them to seek treatment. And oftentimes, I think, what we see is for kids, especially if they're able to seek care earlier and to get in with a good therapist and to understand more about what's going on and ways to be able to help themselves feel better. And then if there's medications that are needed to help them, they're often in a better place, when they're in their, say, 20s and 30s and they're looking maybe to get married, versus someone else who, if the parents, if that shame and stigma sort of outweighed maybe even the enormous love and concern that they had for their child, or if they maybe were in denial and sort of thought, oh, it's just a phase, they'll grow out of it, let's just wait, it's really not that bad. But problems sort of persist. Oftentimes those people in their 20s and 30s or even 40s are continuing to have significant problems. And if they do end up getting married, that doesn't go away when someone gets married, right? And so then a lot of times that's where you see a lot of marital conflict and divorce, etc. So I think that it can be helpful to seek that care earlier, rather than later, and instead of sort of brushing it under the rug. It's hard. It's hard to acknowledge that there is a problem with your child. There is that degree of grief and loss almost, because as a parent, you sort of have these expectations for your children. And when those expectations maybe are not being met, or there is a significant problem, there is some sadness and grief surrounding that. And that can be hard for parents sometimes. So I think if they are able to kind of get through that and get to that point where they can seek care for their children, there's wonderful treatment that's out there and available for people to access and can help their kids, so that way they can be as mentally strong and healthy, and armed with all of the tools and strategies, and to be able to head into young adulthood feeling prepared. And I think as parents, like, that's really the goal, is that we want to help our kids to be as prepared as they can, to be healthy, responsible adults.
Yeah, absolutely. I think that's a really important point. When you mentioned that the problems don't necessarily go away, they won't necessarily go away on their own. So you can try to, sweep it under the rug and hope that you can silently move forward and settle down in life, or, move forward in career, or whatever it may be. But that those problems will continue to arise, but also they may be exacerbated or get worse in the future, right? And you talked about some of the marital problems that can come with that, and unfortunately, divorce even. And these become issues of, this wasn't brought up beforehand, or, the issues have gotten worse for the individual. So, as you had mentioned, it really is important to address this head on early on and not worry about what others may think, because what others may think, I mean, that's not going to help the individual at the end of the day, right? Other individuals and their maybe what they may think or what they may talk about or the ignorances that they have themselves, that's not going to contribute in helping the individual in any way. So why worry about that more so and put off getting help when you can? And as you had mentioned, giving individuals those tools early on so that they can be prepared. And hopefully, some of those issues may subside, some of those may continue and may be lifelong. But as long as the individual has been able to hopefully seek out that proper treatment, get those tools, they'll hopefully know how to address these issues as as you progress in life. And you also mentioned the aspect of some parents may think that it's just a phase or it's a part of their personality. And, that's something that we also know you can't necessarily grow out of a lot of these mental illness and mental health issues, right? I know during adolescence and some of the issues that maybe kids of today's time deal with when it comes to social media and, you'd hope that some of the kids may be able to grow out of those phases where they're not as attached maybe to social media or the concerns that they have of what other people see of them or how much they may like a particular post. But there are really true differences between some of those adolescent concerns and the mental illness that may derive from that, or the mental health issues that may derive from that, but also ones that can, again, carry on lifelong, right? Yeah. And so the other thing that I wanted to ask about or talk about, when we talk about particular faith-based groups, is the thought or notion of being able to pray it away. Of course, we talk about prayer being a strong pillar in our lives and how important it is to help us get through some of those times. Some of the individuals who are dealing with anxiousness or depression, I think the prayer is, of course, an important aspect to help us get through those difficult times. But at the same time, um, how do you address those concerns or those thoughts that people may have when they say, well, this is something that we can just pray for and it'll get better on its own?
Right, right. And you hear that quite often as the answer that maybe an uncle or a family member or a community member might give, or a parent even. And while prayer is absolutely important and life saving for people. There has to be that work that you do on your own as well too. So, like in that hadith that says to tie your camel and place your trust in Allah. It's so interesting when you think about it. It says tie your camel first and then place your trust in Allah, right? So, we have to do that work ourselves and that we can do, right? And I think so much of treatment around mental illness is really empowering people to realize that they have that strength within themselves to be able to do what they need to do to overcome their depression or their anxiety. And I think placing your trust in Allah then helps to sort of reassure and reaffirm that autonomy and that self-empowerment that we have. And it's so interesting, like when we think about the treatment of depression and anxiety, so much of the behavioral strategies and self-care strategies that we talk about are aligned exactly with what Islam tells us. So especially sort of now in the context of COVID, where so many of our routines have kind of like gone out the window and we're trying to establish new routines, that's sort of the first thing is, have a routine, right? And Islam gives us a routine. It's like, here are 5 prayers to have during the day. And those are a constant, right? Those never change. And so it's really quite amazing, subhanAllah, when we think about just, how much wisdom there is in terms of like mental health that we can find in Islam. And so, when you think about, recommendations for meditation, I mean, that's dhikr, right? Like being able to have that like one-on-one time with Allah, and just to really, get in that zone where you can feel peace and sukoon in your heart. I mean, that's from Islam as well. And so I think it's easy sometimes when there's a lot of secular sorts of people kind of pushing things like yoga and meditation, which can help, but it's like when you sort of tie it with that intention of pleasing Allah and praying to Allah, it's like that's where those doors get unlocked, and you feel that peace in your heart. So there's so much that's there that Islam gives us that can be helpful. So of course, yes, prayer is helpful, but there's sort of within that, there's so much that we can do to help ourselves feel better also.
Yeah, so I think kind of going along with that, the concept of being able to pray it away, I think, as you had mentioned, there's a lot of solutions within faith, whether it is Islam or even Christianity. I'm sure they have their own ways, or Judaism, or any faith in particular that helps you get through some of these difficult times. But we have also been given the intellect and logic and reasoning and the capabilities to advance as human beings and as a society, right? Whether it is furthering research when it comes to mental illness and mental health, and finding solutions through the development of medication, when we do these clinical trials, and finding various forms of therapy as well. And so we've also been given this intellect to advance as human beings and find other solutions as well. But that shouldn't take away from, of course, the religion and prayer aspect as well. And there's a lot intertwined within faith that provides us with solutions as well, right? But with that, we also understand that that may not be the only solution by itself, right? We have other means of providing support, whether it is through therapies and medications. But alongside that, again, continuing to make sure that you are staying close to your faith, and staying true to your faith, and adhering to the practices. And you made, of course, a great point. This is something we had talked about in a conversation before, as well as the tying your camel and placing your trust in Allah, where we hear hadiths about the Prophet Muhammad coming across a Bedouin who had his camel and had not tied up his camel, and the Prophet asked him, why haven't you tied your camel? And the Bedouin says that, I put my trust in Allah. And the Prophet then says, as you had mentioned, tie your camel first and then place your trust in Allah, right? And what I understand from that is it's important that we take some of these actions ourselves, whether, again, if it has to do with mental health and mental illness, seeking out that treatment, or any other medical condition, seeking the treatment that's available, seeking the help that is currently available as well. And then with that, continue to put your trust in Allah subhanahu wa ta'ala, and pray for the best outcome possible. So we have that hadith for a reason as well. And when we talk about, I kind of also want to emphasize on the confidentiality aspect, because I think that's something that I in particular hear about quite a bit. And when individuals are looking to, they know there's a problem, whether it's a family member or themselves, they're looking to seek out that treatment. And sometimes the nuances are understood by people of similar cultural and faith backgrounds. But the other, what may feel like this catch-22 is, well, they'll be able to understand the issues that I'm dealing with because I come from this particular faith and culture. But I'm also concerned that, well, they're part of the community, will they potentially bring it up in conversation to someone else when they're speaking to them? Or, you're at a get-together at someone's house and you're talking about all types of things, and will this potentially come up in those conversations? And as you had mentioned, something that's really important to understand is that individuals that are clinicians, are going to be professional and ethical, right? And at the very least, will have to abide by the laws of HIPAA that are in place, right? Because they don't want to lose their license. They don't want to, stop having to practice. So it's really important that we place that trust in the system that's been created, but also in the individuals who we feel may be professional and ethical, and hope that they will abide by those rules and will abide by those ethics. So don't allow that to be a major hurdle in seeking out some of that treatment and help as well. We really want to break down some of these hurdles for individuals that I think may be, understandable, of course, whether it is the shame, again, that comes with it, what other people may think, concerns that professionals may talk to other individuals, but we really want to address those point by point and make sure that these are no longer obstacles for people to go and seek that treatment, because there are a lot of these difficulties throughout the process, right? When you're dealing with the issues already, then family is affected by those issues. Maybe your work and schooling is then affected by these issues. And rather than being able to go and get the help that you may need for it, because those tools potentially exist, we put, unfortunately, some of these obstacles and hurdles in the way that make the whole situation even more difficult to address. So I think that was great that we talk about the confidentiality aspect as well, and help people understand that, fortunately, we live in, at least in the Western society, we live in a place where some of these rules are put in place, and people are really penalized if they don't abide by them. And that's something that, if courts have to get involved, licenses have to be taken away, that happens as well. That's the reality of the society we live in. So I hope that we, as a community, can put our trust and our faith in the professionals that are there to, help us get through these difficult times. Another point that we had talked about before, and that I want to also touch base on, and this is something that we'll kind of just briefly go over, because I think, as we had mentioned, this is a conversation that you can have in itself, and really give it the spotlight that it deserves. And but yesterday was today is October 1st, yesterday was September 30th. So yesterday was National Women's Health and Fitness Day. And speaking about women in particular and mental illness and mental health, I think in a conversation that you and I had before, you had talked about really understanding and addressing mental illness and mental health over a woman's lifetime, right? And some of the issues that they may be dealing with in particular when it comes to things like postpartum depression, and things along those lines. Can you kind of touch base on some of that as well, and give us a little bit of an overview of some of the women-specific mental health issues that you see? And again, hopefully we can expand on this down the line as well.
Mhm. Sure. So there are oftentimes certain points in a woman's lifetime that are a little bit more of a higher risk time for experiencing a mental illness. And oftentimes they can be during times of hormonal fluctuations. So it might be as an adolescent, as a young woman is starting to have her periods, she may experience something that's called PMDD, or premenstrual dysphoric disorder, which is a little bit different than PMS, and it's more severe, and more of an impact on a person's mood and functioning, etc. So that's something that sometimes can come up. And then as women grow older, oftentimes, if we think about like women in their 20s, a lot of times that's when more serious mental illnesses are starting to develop. So whether that's something like schizophrenia or bipolar disorder, that usually would show up in your 20s. And then if we're thinking about things like depression and anxiety, it's oftentimes coming up either late adolescence or early adulthood. And sometimes that can be kind of triggered by different life stressors, whether it's trying to get into the college that you really want to go to, or once you're done with college and trying to find a job. Especially in the last several years, that's been pretty difficult for people. Becoming more independent, trying to get married, potentially even going through divorce. We see a lot of those issues come up during the 20s in a woman's life. And then, as you get into your 30s, you start to see things more, along the lines of if women are starting to have children, they may run into things like postpartum depression, even postpartum anxiety, which is something that isn't talked about as much, but is still experienced by a lot of women. And then, as women get into their 40s, trying to sort of think about, if they're working, how are they balancing career, and if they have children, if they're not married and they're single, sort of going through that, and sometimes even having to be taking care of parents sometimes, as you're in your 40s and 50s, and that caregiving burden oftentimes is placed on women, versus men. And then as you're approaching menopause, as you're approaching your 50s, all the menopausal symptoms that women can experience, and a lot of times there can be some depression or anxiety that comes up during that menopausal period. So for women, there are several very common times where people can experience mental illness.
Yeah, and again, as we had mentioned, hopefully that's something that we can definitely delve a lot more deeply into. But one thing I do want to touch on that you just mentioned, postpartum depression is something that you do hear a bit more commonly. But can you give us a bit more of an understanding of the postpartum anxiety, which again is something that maybe a lot of people don't hear as much about?
hmm Right. So postpartum anxiety can sometimes look like having a lot of anxiety or worry that's excessive and out of proportion to, the common worries that parents have after a baby is born, especially for first-time parents. There can be a lot of very normal anxiety about their babies, and are they eating enough? Are they sleeping enough? But where it gets to be an issue with postpartum anxiety is that those worries can sometimes turn into uh, compulsion sometimes, where women are repetitively checking on the baby. Is the baby breathing? Is the baby still alive? That fear of maybe the baby has died, or the sort of irrational fears that can come up, and then the sort of checking behavior that can occur too. So sometimes it can look like postpartum OCD. Sometimes women can have very intrusive thoughts that are very disturbing. Sometimes it's images of them harming their child even, and that can be incredibly scary to experience, and even scarier to even think about reporting to a physician that I'm having those thoughts. A lot of women are very afraid to tell their physicians that they're having those thoughts, but it's something that is actually experienced by a good number of women. And for the large majority of them, it's not a thought that they would ever act on, but it's there and it's disturbing, and it can be problematic, and really kind of start to interfere with that bonding process that occurs, between mom and baby. So postpartum depression oftentimes gets talked about, and people may kind of know what that might look like, but postpartum anxiety is there too.
Yeah, can I ask also about that? I mean, if let's say someone listening to this is hearing this for the first time and have had those potential thoughts and have had also those concerns that you mentioned of even bringing that up to a clinician, what would be some of the steps that they, again, after hearing this, what are some of the things, some of the initial steps that they can take to hopefully address this?
Well, I think it's very important to tell your doctor, so whether it's your OB doctor that maybe, delivered your child a few weeks ago, or even the baby's pediatrician or your own family doctor or internist. It's really important to tell someone about those thoughts, because, unfortunately, in a small number of cases, I mean, women can harm their children. It's a very rare thing, but sometimes it can happen. And of course, then it becomes the physician's work to figure out like what's going on with that person. Are they at risk of harm to themselves or harm to their babies? Uh, because that can happen sometimes too, where if a woman is really having a lot of distressful thoughts about themselves, feeling as though they're not a good enough mother, um, they're not really bonding well with the baby, they're not able to enjoy their baby. Sometimes women do end up harming themselves because they are so depressed or anxious. So the most important thing is to tell your doctor about those thoughts, and that way they can work with you to help get you the care that you need. And sometimes that does involve seeing a psychiatrist who is really much more, they're in a better place to be able to evaluate, what is going on with that woman and what treatment would be the best treatment for that person.
And I think one of the concerns as to why a mother may not bring that up or may be concerned about bringing that up is the worry that their child may be taken away as a result, right? How does that happen, or how can we address that so that women can seek out the treatment without that immediate concern?
Mm-hmm. Right, that can be a worry. But of course, the most important thing is the health and safety of that mom and baby. And really, if having that mom see a psychiatrist is going to be the best thing for mom and baby, then that's what has to happen. And oftentimes, psychiatrists, especially those that are really well versed in treating postpartum disorders. The nice thing is, especially in the Chicago area, there's a lot of psychiatrists, either at academic medical centers in the city or out in the community, that are well versed in treating postpartum depression and can really help mom to start feeling much better. And there's even a new medication that has come out recently specifically for postpartum depression. And there's a lot of positive talk about the women doing pretty well with that new medicine. So there's always help available. I think if you take anything away from what we've talked about today, is that there's always help out there, and if something doesn't work, there's always something else that we can try.
Yeah, and I think that kind of goes back to some of what we talked about with the shame and some of those barriers is that there is help out there, and that is the first step. Is one, of course, addressing that there are issues, or acknowledging that there are issues. And as you had mentioned, there's help available, and just because one thing doesn't work for you doesn't mean that nothing will work, and that there are options of various things. And even when it comes to the clinicians that you're working with, if a particular psychiatrist or therapist that you're working with is not a good fit for you, there are others. It doesn't mean that it's not going to work for you at all. It's okay to go and try a session with someone else as well, right? So one of the last things I do want to talk about as well is the current times that we're living in. And this is, again, something that you had brought up in a conversation that you and I had previously, was the distressful times and the difficulties that families and people are facing when it comes to COVID. I think as there's of course the anxiety and concern that something may happen to you, or that you may be a carrier and you can potentially get someone in your family sick, whether you're living with parents, grandparents, things along those lines, or you have kids. On top of that, then there's concerns of the job that you may have. Will I have this job tomorrow? Will the place that I'm working at shut down all of a sudden and lay us off? And in the news, unfortunately, from what we're seeing, thousands and thousands of people are losing their jobs as a result. Whether you work in the restaurant industry, whether you work at some sort of outdoor amusement type facility, even airline companies are laying people off now as well. Even in healthcare, there was a time initially, even though we thought that there were so many people that were needed, there were sectors of healthcare where people were being furloughed as well, so it's not necessarily that you're safe from potentially losing your job, right? So everyone's kind of going through concerns, whether that is a loss of a job, loss of income or funding, how you're going to pay for certain things, how am I going to put food on the table for my kids. These are, I think, modern day or today's concerns, I would say. And how are you seeing that taking place with patients that you're working with? What are some of the ways we can address that? And even some tips of how to deal with the stressors of today.
Mhm. Right. Yeah. People are going through a lot right now. And I have patients that have talked about losses of jobs, or being on hold and not being called back yet to work. And so there's definitely a lot of transition, and so much of that is really out of our control. And I think, when something like this happens, and our lives get kind of turned upside down, it's important to try to hold on to, out of all of that's everything that's going on, what part of it can we control? Like what part of it can we do something about? And I think that can be helpful to realize that there's a lot that's not within our control, but to focus on what are the things that we can do. So if someone has, let's say, lost their job, and is there some kind of opportunity within that loss? Sometimes we talk about sort of like reframing losses and difficulties, and trying to sort of see, is there some thing that I'm supposed to get out of this? Is there some lesson that I'm supposed to learn? Is there some opportunity that's sort of hidden within this loss that is there for me? Because as a believer, we always say alhamdulillah for whatever happens, good or bad. That sort of really speaks to that like trust that we have in Allah, and that we may plan, but Allah is the best of planners. And so maybe there's something that I'm supposed to get out of this. And so, maybe for some person it might be, maybe this is the time to look at a different profession, or to try to look at a different job, or maybe it's an opportunity to move somewhere else where there's job opportunities. And it's different for everyone. But I think sometimes it can be helpful to keep that perspective in mind, and to realize that a lot of people are really grieving a lot of losses, whether it's the loss of a job, or a loss of an experience, or it's milestone experiences, for so many kids, especially that were graduating last year, that didn't get to go through their sort of typical maybe college graduation, the thing that they had worked their whole lives for. And so there's a lot of loss that people are experiencing. And I think what can be helpful sometimes is to think about that loss through the framework of grief, and the stages of grieving. And so if you think about those stages, that initial stage of shock or denial, we saw that with, as the pandemic was sort of approaching, like, that thought of, well, maybe it might not be so bad, or, oh, it'll only be a few months and things will go back to normal. And then that sort of like realization of, oh, this is kind of bad. It might not just be over in a few months. And sometimes there can be then, that depression that comes through, and anger that can be there. Why is this happening? And anger about having to wear a mask, or about the losses that people are experiencing. And there can even be, depression too, where, there was, a point in time, I think, during the pandemic where, probably around April, May, people were really starting to feel very unmotivated, not energetic, not enthused at all, and even kind of depressed. And so we saw a lot of people seeking care, that had never sought care before, or maybe had things kind of simmering under the surface, but this was the thing that really pushed them over, and they they weren't able to handle all of the sort of ramifications that came with the pandemic. And so there can definitely be depression. But hopefully, on the other side of that depression is that stage of acceptance where you're able to figure out a new routine and institute some new practices. You're getting used to wearing your mask at the grocery store now, and it's sort of become a new sort of reality. And then some psychologists have even added another stage after that called meaning, where maybe you're able to, especially if you haven't gotten sick or you haven't had a family member that's maybe died from COVID, and the losses have been sort of less, maybe there's some meaning that you're able to take away from this, right? We saw people that said, I was able to spend more time with my family. We didn't have that hustle bustle of going from one thing to the next, and we had more time to spend together. So I think sometimes that can be helpful to sort of think about the losses that we've been experiencing sort of through that lens of grief, because a lot of times people can be experiencing emotions, whether it's anger or just really feeling super low and depressed, or maybe it's feeling highly anxious, and it's hard to know, like, where is this coming from and why am I experiencing it? But it's very understandable and sort of par for the course for what we're going through.
Yeah, I think that's really, some of what you just said right there, of course, of seeing, it's kind of the cliche, right, of seeing the glass half full, and it's really the perspective that you have on things. I think similar to what you had mentioned, it's really about saying Alhamdulillah regardless of what is going on, because, yeah, we plan, and He is, of course, the best of planners, right? And similar to what you had said, I think that is some of the positive of what I had seen is being able to spend more time with family, whether they're the individuals that you're quarantining with, or for some people that's been a great experience, and some people,
Right.
I don't know if that's been kind of
Right. Yeah. For some people, that's been the stressor that has brought them in, especially for people where they're not in a great relationship. That becomes very difficult when you're now, maybe that person's working from home and now you're just together all the time. So, yes, I mean, there's definitely pluses and minuses. Mm-hmm.
Yeah. So, yeah, of course, I think, this is a unique time that many of us are living through, and it's definitely a first for all of us, I would say, having to live through something like this. And from, again, what I have, conversations that I've had, it has very much been the perspective that you have at the moment. I had a conversation with someone maybe a month or two ago, and they were furloughed at work, and they were looking for, and they're a professional as well. They're a healthcare professional, actually. And the conversation that we were having was, one, obviously kind of getting back out there and seeing what's available as far as job opportunities. But secondly, is this maybe a blessing in disguise if, this could have been a route that you potentially would be facing burnout within the next couple of years? Is this a situation that has kind of forced you to start looking at other roles within that same field that may be more fruitful for you, may provide for a better schedule for you and your family members, for you to be able to spend that time with your family in the future, trying to see it from those other perspectives of, maybe this is what's best for me for this time being. Of course, it's difficult to really see it like that when you are dealing with such difficulty, when you maybe don't have a paycheck coming in next month, and the stimulus check is only going to help so much, right? So I think it is definitely difficult to see it from that perspective when you're going through it. But I think that's where you can lean on some of these aspects of faith or support groups even, right? I don't know if that's something that you guys talk about quite frequently, but there are support groups for these types of situations as well. And there's so many people dealing with the same things right now that I'm sure there's a lot of or opportunity to at least create support groups where people dealing with similar losses can really grieve together in a sense, and that's the other loss too, is there are individuals who have lost family members due to COVID as well, or complications of COVID, right? So that's a loss in itself where, they didn't pass away due to some sort of chronic illness that they may have been dealing with, but had COVID not been around, they may have still been around in our lives, or, had I done this differently, they may not have gotten infected, whatever it may be. A lot of people are dealing with a lot of difficulty in today's current day. And some of the coping skills, can you share also some, or expand on some of the coping skills that you maybe share with your patients as tools that they can kind of expand on?
Mm-hmm. Right. Yeah. So there's a lot that people are dealing with, but also a lot that we can do to help ourselves, I think, feel as healthy mentally as we can. So I talk a lot with my patients about self-care, and sometimes self-care gets kind of like brushed off as sort of um, you know getting your nails done, or getting a massage, or something sort of more kind of at a more superficial level of self-care, I would say, where really what self-care can look like. And sometimes it does look like that, right? Like sometimes that's all that you can kind of have the mental bandwidth for and are able to do, and that's okay. But as you sort of are practicing in incorporating more self-care in your life, being able to say no to things that maybe don't fit with your schedule, that can be an act of self-care. Or alternatively, saying yes to things that might scare you and put you just a little bit out of your comfort zone, that can be self-care too. Sort of thinking about what are things that are going to help you feel better, and so for a lot of people that are experiencing either maybe some sadness or anxiety, or even depression, we talk a lot about different outlets, or different sort of self-care buckets, I call it, where you've got different aspects of your life that are helping to really fill you up. And a lot of times I'll talk with patients, and they're really stressed out. I have a lot of patients that are teachers, and teachers are really stressed out right now. They're being asked to do so much right now, and for some of them, all they can do is come home, they do their work, and they might sort of watch TV for a couple hours, and that's the only thing that they're really capable of doing for self-care. But that you might sort of feel that ease of anxiety sort of melt away, but you may not be getting much in return for that type of self-care activity. So I talk to them, okay, what are maybe some next steps to take in terms of self-care? So maybe it's something that's creative. For a lot of people, art or coloring can be incredibly helpful. Journaling, writing, crafting, even baking can be something that is a mindful sort of activity that they can kind of engage themselves in, sort of escape the realities of the world from, but they oftentimes get something from it. A lot of people also really need that social connection piece too, where they, I see this a lot for my older patients, especially the grandparents out there that haven't been able to see their grandkids as much, or their own children as much. And, they're feeling very isolated and lonely. And so we talk about, okay, what are some other safer ways of being able to connect with other people their age or their family members? So many of us, right? I mean, we need that social connection. So that's sort of one self-care bucket. Another self-care bucket is physical activity. I'm constantly talking to my patients about getting outside, going for a walk. The nice thing is that I see so many more people outside now. People are biking and walking, and I talk to my patients about really trying to start the day, if you can, with physical activity, because it gets that blood pumping, gets that oxygen to your brain, gets that blood flowing, and it's a wonderful way to start the day for your mind and for your body. So that can be really helpful. And then having, we talk sort of about a spirituality bucket. So that may be more sort of formal religious practices, like making sure you're making your prayers on time, making sure that you're, setting time for quiet and peacefulness and silence. It can be kind of hard to find that for a lot of my patients that are, stuck at home. Maybe they're working from home, their spouses are working from home, their kids are learning from home. It can be hard to find those times of quiet, but it's amazing what even 2 minutes of quiet can do. I mean, it feels like an eternity sometimes. So, that self-care bucket is so important. So there's so much that we can do, and I think a lot of times it's important to try, if you can, to sort of incorporate those things, so that way, piece by piece, it all adds up and it all helps to make you feel better.
Yeah, absolutely. Thank you for sharing that. I think that's something that you had brought up in a previous conversation we had, as well as the importance of those self-care buckets, and filling those in. I think people can really hopefully use that as a tool. And it gives, again, a different perspective, right? And a tool that people can carry with them as far as how they can achieve, even these like mini accomplishments, I almost like to see them as, of that self-care, and I think we, especially as maybe as parents, you give so much to everyone around you, and you had talked about individuals really caring for their own parents as well as they become a little bit older. And so at what point in time are you kind of building and rebuilding yourself so that you can continue to do these things in life, whether it is looking after your kids, whether it is having to work from home, like you had mentioned, teachers and having to do so much. I know when I talk to some friends who are teachers right now, the difficulty of just getting students online. There's so many kids who don't either have access to it or just aren't even getting online or paying attention. So there's, a lot of stressors, I think you can say, that people are dealing with, and it's very heightened right now, right? And so it really is important to have that self-care. And yeah, in some ways, some individuals get quite a bit of satisfaction from some of the superficial self-care that you were referring to, whether it is getting your hair done, your nails done, whatever it may be, or shopping, some of those things, as long as it's not getting out of hand, right? But yeah, so it's really important to put that focus on self-care. And I like that concept of the self-care buckets that you had mentioned, and I think overall we've, been able to touch up on quite a few different topics, and been able to at least have this introductory conversation. And I actually want to pull back because we've really been talking about mental health and mental wellness in a sense, and have been using them interchangeably, I think. But can you also, real quick before we end today, provide maybe some understanding of mental illness and mental health, and how those terms differ as well? Yeah.
Mhm. Well, when we talk about mental illness, it typically refers to the common sorts of things like schizophrenia, bipolar disorder, depression, anxiety, substance dependence, eating disorders, and so those are relatively common. If you kind of lump them all together, I mean, there's a good chance that either yourself or someone has experienced one of those things, and in terms of mental health or wellness, I think that term sort of encompasses, all of the things that we try to do to help ourselves feel better, and so, we think about mental wellness, making sure that you're seeking care for the symptoms you're experiencing, that you're following up regularly with your treatment team, that you're taking your medications, that you're taking good care of yourself. So maybe that's eating healthy, maybe that's exercising, maybe that's carving out time for yourself to do something that's just for you. There's a lot that's there, when we think about mental health and wellness.
Yeah. And yeah, it's important to kind of differentiate the two as well, because uh, those they have different conversations that you can have between, again, having the mental health and mental wellness, and how we can constantly, as you had mentioned, whether it's self-care aspects or exercising, eating well. Those are ways that we can continue to improve on our mental health and mental wellness. And then the mental illness aspect, again, are potential diseases that have different ways of treating, right? And therapies that involve that. And, kind of to close out this conversation, what would you say that you would want if there's something that people can take away from this conversation? If there's one particular point that you'd like to emphasize, what would you say that is?
I would say don't be afraid to ask for help. I think for so many of us, we pride ourselves on not asking for help. I can do this myself. I can handle it. Um, and but really, asking for help is part of you taking on that ownership of handling it yourself. So if you're in that driver's seat of driving treatment and therapy, you're the one who's deciding, I'm going to see a doctor, I'm going to see a psychiatrist, I'm going to see a therapist, and I'm going to do the things that are going to help me feel better so that way I can be functioning at my highest potential. So I would say, don't be afraid to seek that care out.
Yeah, and rather than possibly seeing it or perceiving it as a weakness, it should be seen as a way of empowering yourself, right? Because I think unfortunately sometimes the word help can be associated or understood as a potential weakness, right? Having to seek help may be seen as having a particular weakness, but that's not necessarily the case. That's you empowering yourself, empowering hopefully those around you, right?
Absolutely. Yeah. And I think, especially as parents, let's say, or adults, being able to demonstrate for the people that are younger than you in your lives, whether it's your children or nieces, nephews, cousins, that it's okay to do that and to be example of what good mental health can be. And part of that might be seeing a therapist or going for couples therapy or having a psychiatrist. That is a great way of demonstrating, to the younger generation, that it's okay to do that.
Yeah, that's great. I appreciate you taking the time today to, share this with us, and I hope that anyone that comes across this is able to benefit in some way. And I really do look forward to hopefully again speaking in the future and maybe expanding on some of these particular topics and delving a bit further in, especially topics like we talked about with the mental health and mental well-being of a woman over her lifetime, and some of the concerns people may have as they continue to face struggles in the times of COVID as well. I'll hopefully share this or share some information within the context when this is posted as far as how people can reach out. We have an email address, and so I'll share that in the caption below as well, wherever this is posted, so that if people do have questions, concerns, they can reach out. And again, I do want to ensure that if you are reaching out, we are professionals here and things will be kept confidential. I don't want people to really hold back or worry about wanting to reach out and maybe getting that help that they may need, whether it's for themselves or a family member. We're here to be a resource for the community, and hopefully we can guide people along the way. And again, live more fulfilling lives and improve their quality of life, right? The situation you're in currently is not the situation that you have to be in moving forward. As you had mentioned, you were able to provide, a great number of tools just in the short conversation, but there are tools out there that people can hopefully obtain over time and live that full and lead that fulfilling life, So I appreciate your time, and hopefully again we will touch base again in the future.
Sure. Thank you so much for having me.